Hi everyone. So in this video I'm going to be telling you an easy way to memorize syphilis testing. So syphilis is caused by Treponema pallidum. We're going to be classifying the tests into treponemal tests and non-treponemal tests. Any test that has a T in it, for example FTA antibodies or the TPPA, these are all treponemal tests. Okay, once you're positive for an FTA, you're going to be positive for life. No matter if you got treated or you did not get treated, it's going to be positive. Once positive, always positive. Also, the FTA tells you if you have or had the disease. Keep this in mind. The non-treponemal tests are things like RPR and VDRL, and they tell you about the activity of the disease and the effectiveness of therapy. So if you got positive for RPR, this means you have an active disease going on. If you were positive and now you're negative, this means you got treated with penicillin. So as we know, syphilis is composed of stages: the primary stage, secondary stage, tertiary stage, and the late stage. During the primary stage, the chancre, you can only use the dark field microscopy and the FTA antibodies to identify syphilis. And then what happens is that 6 weeks later, the FTA antibodies and the RPR or the VDRL start to rise till they reach their max. So you can rely on these two during the secondary stage or the tertiary stage or the late stage. The problem is sometimes during secondary stage or tertiary stage, the VDRL start to go down. So this could mean two things. Either this patient is receiving penicillin and he's getting treated, or this is a spontaneous regression in VDRL. This is a false negative result. So you're going to need to repeat the test again. Let's do some examples. So if I give you a patient that is positive FTA and positive VDRL, this is an easy one. For sure, this patient has syphilis because the FTA is telling you, okay, this patient has or had syphilis, and RPR is confirming. RPR is telling you, yes, this patient has an active disease at the moment. Next, if I give you a patient that's negative FTA and negative RPR, this is also an easy one. For sure, this patient doesn't have syphilis because FTA is telling you this patient never had the disease, and RPR is confirming. It's telling you there is no active disease at the moment. Next, if I gave you a patient that's FTA positive but VDRL negative, so FTA is telling you this patient has or had the disease, but the VDRL is telling you no, there is no active disease. So this could mean one of two things. Either this patient got treated from syphilis and he received penicillin, or this is a false negative result and you need to repeat the test. Sometimes this could be an early infection. This could be the primary stage, the chancre stage. So you need to repeat the test again. Finally, a classic one, a negative FTA and a positive VDRL. So this is a false positive VDRL because FTA is telling you that this patient never had the disease and doesn't have the disease at the moment. So things causing a false positive VDRL are pregnancy, viral infections like Epstein-Barr virus or hepatitis, D for drugs, things like chlorpromazine, R for rheumatic disease, and the L for lupus, SLE, or the antiphospholipid syndrome.